My name is Dr. Rose Paisley. I'm a naturopathic physician in Portland, Oregon, and I specialize in supporting patients with a cancer diagnosis. And I have been using Charm for 5 years in a group practice, and I'm about to branch off and become a practice of one. I found Charm about 5 years ago when I had moved away from my town that I practice in, and I moved back and I joined a group practice, and I started asking about EMR because I had never used EMR before because I was always paper charts. And the first one I heard about Practice Fusion, and I've heard about Charm, and I started looking at Charm first, and it just made the most sense. And initially it was definitely because of the low volume of patients as I was just starting over, and the cost, it was a lot of bang for my buck, so to speak. And so that happened 5 years ago, and I've just stayed with Charm ever since. My onboarding process has been really easy. I've always only really done it from the practitioner side of things. So once I got the hang of how to chart and just manage the encounters, it became really, really, really easy. And training at the clinic I've been at has always come down to me from the clinic owner. Mm-hmm. And so collectively, she would get trained on the back end. Mm-hmm. We wouldn't know about it. Mm-hmm. And then she would translate that data, that information to us. And so office managers and practitioners were all getting the training together. But I mean, it was so fast and easy. Just to as soon as you learn the back end of the settings, it's all right there. And I would say that the onboarding into other integrations has been slow because our clinic has slowly adopted more and more and more features with Charm. In the last year, we have added on ERX, lab integration. I guess those are the two big ones. And it was awesome. I mean, it changed it actually, by doing that in the group practice, it really helped me realize how manageable it's going to be for me to be on my own. Because I've wanted to go away from the group setting for a long time, but have been nervous about how to manage all of the layers. And by doing that, the amount of time that saved and the ease for the patient and the efficiency has totally given me confidence to take it on. Because I will be going on my own, and I'm pretty sure there are going to be patients, because I'd say once a month somebody comes in who has not completed their questionnaires, which is necessary for my practice, not just the office policies and HIPAA, but consent forms and then intake forms. It's really important that I have those. And so I think that implementing the kiosk so that patients can do those things right before we get started is going to be helpful. And there's a lot of new features coming that are really exciting. I'm excited to try to implement the texting. I think that's going to be amazing for my patients. I mean, the idea of the birthday text and all those things that I can put into place and program are going to be really cool. Here I came to CharmHealth 2019 because I wanted to learn the layers of Charm that I hadn't explored yet, all the administrative opportunities and add-ons and things that I take for granted that are already in place at the group setting. There were lots of great sponsors. So Wellevate was here, who will be integrating in March, which I'm so happy about, and FullScript was here, and I have accounts with both of those companies, and I use them, but I always use their portal for getting information to patients and prescriptions to patients. But this weekend I learned how to integrate into FullScripts, and after they showed me how to do it and helped me through the uploading of I got the link and I implemented it and I played around with it, and I feel like such a silly person for not having done that so long ago because it's so easy. The drop-down menu is so obvious and you can start creating protocols, and I learned all of that, so that was great.